Welcome to this explainer. You really should think of your body as this brilliant, highly trained medical detective. When microscopic invaders like bacteria or viruses breach your defenses, your body doesn't just sit back and take it. No, it actively turns up the heat. It intentionally triggers systemic inflammation to wage a literal full-scale war against these pathogens. Today, we're cracking the case on how our bodies manage this incredible feat, exploring the very precise rules of temperature control, and learning how to read the unique thermal fingerprints left behind by different diseases.
Here's our clinical dossier for this explainer. First, the body's internal thermostat. 2. The mechanisms of pyrexia. 3. Continuous and intermittent fevers. And 4. Highly specialized fever patterns. Let's get right into it.
Section 1. The body's internal thermostat and setting the baseline.
All right, let's dive right into this. Pyrexia, which is just the fancy medical term for a fever, isn't just your body passively getting hot from the environment. Actually, it's a highly calculated, deliberate elevation of your core body temperature above the normal circadian range. And the control room for this entire operation? It's a tiny, powerful region in the brain called the anterior hypothalamus. When you have a fever, that anterior hypothalamus is literally resetting your body's target temperature to a higher level, essentially trying to cook out the infection.
Now, what's really fascinating here is that normal is actually a moving target. Thanks to our circadian rhythm, our core temperature naturally fluctuates all throughout the day. Like, a normal oral morning temperature sits right around 37.2 degrees Celsius. That's 98.9 degrees Fahrenheit. But by the evening, it naturally climbs up to about 37.7 degrees Celsius, or 99.9 Fahrenheit. Understanding this daily ebb and flow is our vital scientific anchor. I mean, you simply can't accurately diagnose a fever if you don't know what time of day the temperature was taken.
Moving on to Section 2, the mechanisms of pyrexia, focusing on chills and sweats.
This perfectly illustrates the actual timeline of a fever. First up, the anterior hypothalamus resets that thermostat higher. Let's say it suddenly bumps the target from 98.6 all the way up to 102 degrees. Well, suddenly, your body looks at its current temperature and thinks, whoa, I'm freezing. So step 2 kicks in. Your blood vessels constrict to conserve heat, and your skeletal muscles involuntarily contract. This causes those terrible chills and shivering because your body is desperately trying to generate warmth. Then, later on, when the fever breaks and the thermostat finally resets back to normal, your body realizes it's way too hot. That triggers step 3, profound sweating to rapidly initiate heat loss.
In a clinical setting, we actually see some very distinct differences between these responses. Notice the definition for rigors here. A standard chill is just that sudden sensation of cold as your blood vessels constrict. But rigors? That's a much more profound chill. It's characterized by piloerection, which is the medical term for goosebumps, and it's accompanied by severe shivering and literally the chattering of teeth. It's an intense, involuntary muscle workout. And as we just learned, the sweat part is simply your heat loss mechanism finally kicking into gear once your set temperature returns to baseline.
All right, Section 3. Continuous and intermittent fevers, and breaking down the patterns.
Let's contrast two primary clinical signatures that you're going to see time and time again. First, an intermittent fever. This one is highly volatile. The elevated temperature actually touches the normal baseline at least once every 24 hours, so visually, it's bouncing up and down, giving the patient these brief windows of relief. We see this a lot in pyogenic infections and malaria. On the flip side, a continuous or sustained fever stubbornly stays elevated. It does not touch the baseline at all. This relentless heat is a classic hallmark of conditions like lobar pneumonia or infective endocarditis.
But here is the crucial detail, the actual math behind a continuous fever. For a fever to be strictly classified as continuous or sustained, the temperature fluctuation throughout the whole day must not exceed 1 degree Celsius. That's it. It stays high and it stays incredibly flat.
But wait, you might be wondering, what if the temperature stays above baseline all day, but wildly swings up and down? Well, that brings us to a subtle but absolutely critical diagnostic difference, the remittent fever. Unlike the flat continuous fever that barely fluctuates, a remittent fever fluctuates wildly, by more than 2 degrees Celsius each day. It falls, giving this cruel illusion of recovery, but it never actually touches the normal baseline. This totally exhausting pattern is frequently seen in patients with lymphoma.
So, we've seen fevers that stay flat, fevers that bounce down to the baseline, and fevers that swing wildly above it. But let me ask you this. What kind of fever pattern climbs higher and higher every single day? Like someone literally climbing up a staircase? Let's find out in Section 4,
highly specialized fever patterns, covering stepladder and Pell-Ibstein.
The answer to our little mystery is the stepladder fever. It's exactly what it sounds like. The temperature rises one day, falls slightly the subsequent morning, but then climbs even higher the next afternoon. It continuously forms these insidious, escalating peaks and troughs, mapping out like an actual staircase right on the patient's chart. This highly specific, creeping presentation, that's a classic telltale hallmark of typhoid fever.
Now consider the downright bizarre nature of the Pell-Ibstein fever. Just imagine having a fever for 3 to 10 days straight, and then, completely out of nowhere, you have 3 to 10 days of totally normal temperatures, only for the whole cycle to repeat itself. This oscillating long-form timeline is uniquely tied to Hodgkin's and other lymphomas. Then, contrast that massive cycle with an evening rise pattern. Here, the temperature is perfectly normal all day, but spikes specifically at night, often bringing these miserable, drenching night sweats. That nightly spike is a massive red flag for tuberculosis.
And this biological clockwork gets even more fascinating when we look at parasitic infections, specifically malaria. Malaria is famous for its intermittent fevers, but the exact timing of the spike literally gives away the specific strain of the parasite. A tertian fever spikes exactly every third day, pointing our medical detectives straight toward Plasmodium vivax or Plasmodium falciparum. Meanwhile, a quartan fever strikes on a strict 4-day interval, specifically indicating Plasmodium malariae. The pathogen literally runs on a biological clock, and the fever betrays its entire schedule. Incredible, right?
Of course, sometimes, despite all these incredible patterns, a fever just defies easy categorization. This is what we call a fever of unknown origin, or FUO. Clinically speaking, we're talking about a temperature greater than 38.3 degrees Celsius, so about 101 Fahrenheit, lasting for more than 3 weeks, with a complete failure to diagnose it despite intensive investigation. When facing an FUO, the detectives have to broaden their search. Based on the data, about 30 to 40% of these cases end up being hidden infectious causes, like occult abscesses. Then, 20 to 30% are neoplastic, meaning hidden cancers like leukemia or lymphoma. And 15 to 20% are autoimmune issues, like giant cell arteritis. It really requires a relentless, methodical investigation to finally uncover the truth.
So we've seen exactly how the body uses the anterior hypothalamus to deliberately change our internal temperature to fight disease. But I want to leave you with a provocative thought to chew on. What happens when the heat isn't a deliberate fever at all? I mean, what happens when environmental factors, idiosyncratic drug reactions, or even severe brain hemorrhages completely bypass that thermostat, resulting in a runaway train of heat known as hyperthermia? Well, that is a completely different, highly dangerous medical emergency and a fascinating mystery for you to investigate next. Thanks for joining me on this explainer, and stay curious.